Hi, I'm Ursula Darby, and I'm a psychic, a medium, and an animal communicator. You're about to watch a pet reading. What does that mean? When I'm reading a pet, I will see what they want me to see about you and about themselves. I will hear what they want to say to you, and I will feel their emotions or any medical conditions. Have a watch.
Okay. Yeah. Okay. Yeah, I know. So, so this one needs to check. I don't know your horse's name, but they need to check out who's coming into a space or whoever's showing up in the first place. That makes sense to you?
Mm-hmm.
This feels like, so I know that horses would have that. There'd be some type of apprehension, but it feels like they're the one that holds the fort of the space, meaning that whoever's out somewhere or whatever, and also calling out or letting anyone know if they're in the field or outside they're the first one to do it, correct?
Oh, yeah.
Yeah, so this is the one that's dominantly does it. Ironically enough, though, seem really chill, really calm, right?
Yeah.
Not.
No.
Not. And that's it. I don't want to touch him,
Mm-hmm.
correct?
Okay.
Is
Yeah,
it
he
him,
can.
right?
Yeah,
I don't want to touch him. Yeah, because I don't know gender. I'm not looking. I know. So what's happening is he's checking me
Mm-hmm.
to make sure who I am, why I'm here, and what I'm doing.
Yeah.
So I'm asking him for different details. So he's confused as to what's happening in the space a little bit because of this being something new,
Yeah.
but at the same time, always knows what's happening. Always knows what's happening. Always know. So it's like, you know that you'd put a goat or a donkey in a field to protect everyone? You don't
Yeah.
need one. You got him,
That's him. Yeah.
right?
Yep.
Yeah. So he's very careful with who's around. So I'm not touching him because I don't have permission.
Yeah.
So I'm letting him check in with me first.
Okay.
I know, right? Yeah. Okay. I'll look away. He's checking my energy.
Yeah.
You don't have to move him back. It's okay.
No, it's
Yeah,
okay.
that's okay. Because I want to let him be comfortable with where he is. Okay. He's still not sure. He's still not sure. Okay. So I know human anatomy quite well.
Yeah.
I don't know horse anatomy, so I'm going to describe it in these terms.
Okay.
Okay. So I'm picking up something that's happening within his chest, lungs, and into stomach.
Uh-huh.
But I want to point out specifically where I'm getting it, and I want you to confirm it for me as I continue. Okay.
Yeah.
So I'm feeling it into my throat, then where my throat comes up and meets up. So you've got sternum, ribs, and into stomach with a human being. Right here, there's a lot of tenseness because I'm hearing him coughing. So there's discharge too. That's in
Yeah.
his nose and in his throat.
Uh-huh.
So this has a lot to do with you would call it not being settled. He's calling it, he's got a really bad tummy ache, something's happening.
Okay.
So there's some type of infection that's gone on. This is something that's been treated before.
Mm-hmm.
So this is something that's coming back again. By the way, it's not been treated fully
Okay.
because I'm now seeing, so I see in detail what he wants me to see.
Mm.
Ready?
Yeah.
What's the tube they put in their throat?
Yeah. Yeah.
Oh, it's gross. You didn't like it.
No.
I know, right? It's horrible. I thought so too. It's gross. So you're putting something into his throat to medicate what's happening in his stomach, correct?
I haven't done it.
This has been done though.
Okay. Yeah.
This has been done before?
Potentially, yes.
Okay.
Yeah.
Okay, because I need to tell you that there's an inflammatory process that's happening in his stomach.
Mm-hmm.
There's some kind of, it's like a bug of some sort that has to be treated,
Okay.
right? I mean, you can't treat a cold, but there's some type of bug. This isn't viral. This is some kind of diagnosis he needs. You're welcome. He doesn't like how he's going to be treated, though.
No.
I need to ask you, though, is there not another way as an injection to do this, to treat this, like an antibiotic injection of some sort?
There could be. Yeah.
Okay, can you look into that before you do the
The stomach too. Yeah.
It's horrible. Because they're putting a tube down his throat and then putting medication in the tube.
Yeah.
It's disgusting. It causes like a gag reflex. The doctor thinks it's okay. This isn't okay.
Okay.
Okay?
Yeah.
So this, laying down. Okay. I don't know this about horses. I've been around horses, but not a lot. They lay down to sleep.
Sometimes. Yeah.
I'm saying, but laying down like where they're laying on their tummy with their like on their elbows.
Yeah.
Okay. After he's eaten, it's like he's got reflux. There's stuff coming up.
Okay.
There's food coming up.
There you go.
Okay. What else do you need me to know?
That was a lot of it because
Okay.
I know.
No, I'm asking him.
Oh.
Hold on. Give me 1 sec. I
Okay.
just need to ask him real quick. When he lays down. Okay. Yeah. Do you understand what I'm saying? Because
Yeah.
I've never seen a horse lay down like that. So it's like he's laying and it's pushing on his tummy and everything's coming up.
Okay.
So there's something that's like a reflex of some sort. I didn't know horses could get that, but it feels like that. There's a lot of acid.
Yep.
that I'm getting.
Okay.
And it's also, I want to say, it's coming at his nostrils. He's coughing and it's coming at his nostrils too.
Okay.
So, I asked you to know. Okay. You need to know it's, you're not doing something wrong. There's something happening with him.
Yeah.
Because I'm asking him if it's food or things, and he's like, no, everything tastes good.
That's good.
Everything tastes good. Everything's good, but he's feeling sick.
Okay.
He doesn't appear to me to be sick in any way. I'm not feeling that.
Yeah.
So this is digestive stuff. So
Okay.
this is something this is something that's manageable
Yeah.
and make him feel a lot better. He's unsettled, can't relax, and can't get to a state of comfort.
Good to know.
Does that make sense?
Yes, it does.
What questions do you have about him that you want me to cover within the time?
That was it.
Really?
Because I knew something was going on digestive-wise, and I have not yet been able to pinpoint it.
So can we talk about the kinds of symptoms and things that you've picked up with what
Yes.
you've? So what I've said to you,
Yeah.
how did it match up?
He has severe heaves, so he does get really coughy in the summer,
Yeah.
and he really labor breathing.
Yep.
He is losing weight, and
Yeah.
he just does it
Yeah.
randomly.
Yeah.
So like he held weight great all winter,
Yeah.
and now he's starting. The last 3 weeks, he's starting to lose weight again.
Yeah.
And I've had the vet out, and we've checked, and I feel like we have not yet found a solution.
Is there any way to test him, to have him spit up or have them swab or something?
Yeah.
If he's coughed, can they do that?
Yeah, they can.
Because I want to tell you it's in there.
Okay.
What they're going to find is in that. So it's not through blood work.
Okay.
It's through like spittle. It's through spit
Okay.
that they can diagnose what's happening. I won't touch you. I promise I won't. I will after though, because I'm helping you, remember? So I just want to talk to him a little bit further. Find out what's happening. Anything else you wanted me to know? What's the screeching or the bell sound, the loud bell sound, strong bell sound that's coming from the house or the road?
Bell sound.
There's tractor trailers that are going past.
Yes.
It's hitting the brakes, that sound, it makes it, and it's that loud sound.
Yeah.
Can't stand it,
Oh,
makes him
really?
crazy.
Good to know.
Can't stand it. And I know there's nothing you can do about that, but I'm asking him if there are other things. So do the sounds, like a high-pitched sound too, so this is to do with a horn or like a bell that's coming from the house or from the road?
And my husband's got a transport truck next door, and he's got an air horn. It could be it.
You think?
Yeah. I could do it.
Yeah, doesn't like it.
Okay.
It hurts him, it's piercing, it hurts his ears.
Okay.
He's very comfortable with where he is, he's happy with where he is,
That's
he's
good to
just not feeling well,
Yeah.
and he's not getting comfortable. So this is not about your treatment, this is not about how you're caring for him. There's something that's being missed
Yeah.
that you need to look into a little bit further. Is there
And we
anything else that you
definitely
need?
will.
Back right,
Yeah.
back right.
Back
So
right.
back right hoof,
Yep.
right? Back
Yep.
right hoof, because I asked him one last thing. So so there's discomfort, and it feels like it's like a stab in the middle of the foot underneath
Okay.
when he's stepping and putting weight on. And I also want to say that there's some type of muscle atrophy that's around the right hip,
Mhm.
right?
Mhm.
Yeah.
Yeah. And
Yeah.
he's nonstop abscesses
In the foot.
in the foot,
It's
in the back
middle, right in the middle. Yeah.
Yep.
Yeah. Yeah. So,
Okay.
oh, you've had there's a cup or a plate you've put inside of it with the, oh my God, I can't think, because I can't, okay. The person who does it, the
Barrier.
thank you,
Yeah.
because I can't think. There's a plate or something that they can put into cushion to pressure it to heal it.
Good to know. Okay.
Okay, because they're going to cut around it and they're going to put a plate in, because there's infection that's running up into the ankle.
Okay.
Yeah. So this will also, so there's two things happening, tummy digestion and the back foot. So
Okay.
the injection is a part of to heal up in the back foot, but the farrier has to put in some type, it's a plate, it's like a plastic plate that protects his foot.
Yeah. It goes on the bottom of their foot.
Yep.
Acts as
Yeah.
protection.
Thank you. Can I pet you now?
This is only if you've got treats.
Thanks for watching. If you want to reach me, you can find my information on the next screen. Are you a little bit weirded out? Don't be. This is totally normal. It's perfect.